Hello, everyone. Welcome to today's webinar. Thank you all for taking some time today to join us to learn about workplace mental health. And before we get started with today's session, I just want to give you some updates about some upcoming events. On Tuesday, May 7th to Wednesday, May 8th, will be California Labor Lab's third annual conference, and that will be from 9 a.m. to 3 p.m. Our theme this year is Modern Work and Workers' Voices, and I'll put a link to the registration for that event in the chat. And this is a free registration. Anyone can attend. If you'd like continuing education units, there is a fee, but generally speaking, it's free registration. Our next webinar will be on Wednesday, May 29th, with Dr. Christina Banks on creating a new building with total worker health. And you can learn more about upcoming webinars on the CA Labor Lab website. On behalf of the California Labor Lab and NIOSH Center of Excellence for Total Worker Health, we're pleased to welcome you today. A few more housekeeping items. You are going to be muted during today's presentation. So if you'd like to ask a question, we invite you to enter it into the online Q&A. And we'll save time at the end of the presentation to address as many questions as possible. This presentation is being recorded and will be made available on the California Labor Lab and Center for Occupational and Environmental Health YouTube page within the next 5 business days. And all participants who logged in with their full registration email for the full live presentation today will receive an email tomorrow with a link to the evaluation form that will qualify participants for a certificate of completion with 1 continuing education contact hour. Once the evaluation is completed, you'll be able to access and print your certificate. Without further ado, I'm going to hand it over to Dr. Christina Banks.
Welcome, everyone, and I couldn't be more pleased to introduce our speaker today for the webinar, Dr. Leslie Hammer. She's a colleague and a friend, and I'm very anxious to hear her presentation. Dr. Hammer is the Associate Director for Applied Research in the Oregon Institute of Occupational Health Sciences and Director of the Oregon Healthy Workforce Center, a Total Worker Health Center of Excellence at the Oregon Health and Science University. She is also a professor emerita at Portland State University and a leading international expert on workplace mental health, work and family, and occupational stress. She specializes in the mental and physical health effects of supportive supervision at work and has extensive experience in designing, implementing, and evaluating worksite interventions and evidence-based supervisor training, including the Family Supportive Supervisor Behavior Training and the Mental Health Supportive Supervisor Behavior Training. Dr. Hammer, the floor is yours.
Thank you so much, Chris and Michelle, and thank you to the Cal Lab for inviting me to present today. I am very happy to be able to share with you my thinking and research around workplace mental health, and specifically really taking on a population health framework towards understanding and thinking about mental health at work. I am the director of another Total Worker Health Center, the Oregon Healthy Workforce Center, which is funded by NIOSH. And I just want to acknowledge my colleagues as part of the Oregon Healthy Workforce Center and as part of our larger institute, the Oregon Institute of Occupational Health Sciences at Oregon Health and Science University. Today, I'm going to be talking about mental health and occupational health, and I will be introducing concepts related to job stress and psychosocial risk factors, and then moving into a population health approach to mental health. And then towards the second part of my presentation, I will be talking specifically about healthy leadership strategies for supporting worker mental health that are evidence-based strategies that I have researched with a number of colleagues. So let's first talk about mental health. And when we talk about mental health, we can really refer to, first of all, our existing experiences and our existing feelings about our psychological health, whether they are positive or ranging to more difficult challenges. So mental health isn't just the absence of illness, but it's a state of positive well-being. And what happens, however, is that frequently we are kind of falling into a compromised situation where our mental health is compromised and we experience mental health conditions that may be related to distress, anxiety, and this is sort of the point where intervention can potentially help things from deteriorating further. But unfortunately, what does happen for a number of individuals is that mental illness does arise, and mental illness really are those diagnosable illnesses. So if we don't intervene at really the mental health condition level, we may experience mental illness. And this is where it really requires professional intervention and treatment. But what I'm here to talk about really is talking about prevention and how can we prevent individuals from moving into that more severe level of mental illness. Mental health conditions affect so many people. And we know from national data and international data that, for example, 1 in 5 people, and sometimes the data are 1 in 4 in the United States, will experience a significant mental health problem or illness each year. And 1 in 3 will be diagnosed with a mental illness at some point in their lifetime. And we also know that since the pandemic, 1 in 5 have reported that their mental health has worsened. So who does this affect? It affects all of us. You, me, our coworkers, our supervisors, our employees, and we need to remember that. We can't just think of mental health challenges and mental illness as being outside of the workplace, because that's not the case. And we need to understand how the workplace contributes to causing some of these more severe experiences of mental health decline, but also how the workplace can contribute to promoting and protecting our mental health. And I definitely take a biosocial psychological perspective of mental health in that the idea is that our mental health is impacted by our environment, as well as our biological makeup, as well as our psychological experiences. And so our mental health really is the intersection of the social, biological, and psychological experiences that we have. And what this means is that we can actually take a population health approach to mental health and look at prevention, because there are a number of aspects in, I should say, those, if we go back, the social and environmental sphere here that can impact and help either prevent declines or reduce declines. So there are problems, however, with our current mental health system. And when we kind of move out from the individual level and take more of a population health approach, we can start to identify some solutions. But first of all, what we do see is that a current mental health system focusing on individual treatment and individual behavioral health has really resulted in significant disparities. There are disparities in terms of who is able to actually seek treatment, as well as who is feeling comfortable in terms of obtaining treatment. And so those disparities can be are a problem of our current mental health system. And when we take a step out and we think about and identify really ways of preventing declines from a population health perspective, we in turn can help reduce some of those disparities. And the emphasis on individual treatment is what it does is it removes it stays away from the idea that systems are part of the causes of our mental health declines. So I want to make very clear, I am not saying that individual level behavioral health is not good. That is absolutely needed. It is absolutely needed. It is, however, one piece of the broader system of approach to improving mental health. So it's one piece. So what I do is kind of step out and look at environmental and systems factors that can also help promote mental health and reduce mental health declines. And there really has been a lack of attention to the promotion and prevention of those declines, and the lack of attention to the reduction of risk factors, which I'm going to be talking about now specifically within the workplace. And there has been much more of a heavy reliance on mental health care providers. What we see, though, is that we don't have enough providers to actually deal with the mental health crisis. So we better start taking a population health approach. And actually, I just came back from a last weekend, part of American Psychological Association consolidated boards and committees meeting, where it was very clear that APA is American Psychological Association is also promoting a population health approach to mental health, that we can't just focus on behavioral health providers. Again, they are critical, absolutely critical. It's critical that we improve and enhance our behavioral health workforce, and that we make it, because we need to make more available behavioral health for the population, but that's not the only answer. So a solution is population health approach to mental health, which considers broader systems prevention, schools, communities, workplaces, and addressing mental health through prevention, promotion, risk reduction, in addition to treatment. So the population health approach really focuses on prevention as a key. And again, it takes this systems level approach to prevention that focuses on both the individual, but also, when we talk about work, the occupational risk factors and exposures, which we will be elaborating on. And so the reduction or elimination of workplace physical and psychological exposures can lead to improvements in health, safety, and well-being of our workers, and ultimately improving mental health of our workforce. And this has been addressed globally, and very important calls have come out by the World Health Organization and the U.S. Surgeon General. So back in 2022, in September of 2022, the World Health Organization came out with guidelines on workplace mental health. And those guidelines identified the critical role of workplaces in supporting and promoting mental health of workers. And part of the reason here is because so many people across the globe are part of workplaces. And I'm not talking about physical workplaces anymore. Remember, many of us work virtually. Many are also still required, and it's necessary to be at a physical workplace. But when I say workplace, workforce, I'm talking about all different kinds of work arrangements. And so is the World Health Organization. Also, in October of 2022, the U.S. Surgeon General came out with the Workplace Mental Health Framework. And I was fortunate enough to be part of a research roundtable that fed into the development of this framework, where we really focused on the systems within the workplace and workplace redesign and workplace support that can contribute to promoting mental health. And I also note that the Surgeon General came out with a report on the loneliness crisis in the spring or May of 2023. And that report sounded the alarm on what we are seeing across the country and across the globe around the lack and the reduced social connection and the increased amount of loneliness. And loneliness has been significantly related to mental health declines. So it's further implicated in decreased mental health. And coming back around to the workplace, I have focused on ways of decreasing loneliness at work through social support strategies, which I'll address in a little bit. So what I'm really talking about are social determinants of health here. That's really the idea that our health is impacted not just by what happens to us physically or what happens to us, what our biological makeup is, but there's aspects of our our community, our social systems, and our work systems that cause declines in our health and declines in our physical health as well as in our mental health. And so, what better way to address mental health as a workplace psychologist? So, I'm an industrial organizational psychologist and an occupational health psychologist, than by really looking into and understanding ways that we can reduce risk factors at work and promote health and well-being. So, the kind of crux of reducing risk factors at work can really start with understanding job stress. Now, job stress is referred to as harmful physical or emotional responses that occur when requirements of the job don't match our capabilities. And job stress is experienced by everybody to different degrees. So I don't know of a job where there is not job stress. For example, even jobs where there's not where there are very low expectations and not much going on, that in it of itself it creates stress when there's not a lot of stimulation in a job. So job stress is experienced really across the board, however, to different degrees. And what we know is that there are factors within the workplace that are modifiable that we can really focus on to reduce job stress. And those are what we refer to as psychosocial stressors. And so these are aspects of the workplace that impact our psychological health and well-being and that are modifiable. So, for example, I think, there we go, low employee control over work. When people, and these are all research backed, this is all evidence-based. Low levels of control are related to high levels of stress and high levels of job stress. Similarly, low levels of pay, and there's clear relationships between economic stress and overall psychological well-being. High uncertainty at work that causes job stress, which is just as low social support. Negative interactions with supervisors or with coworkers, and low job security. It used to be in the old days that jobs were almost thought about as forever. And there's no security these days with jobs. And people really change jobs frequently. And because of that lack of security, but that lack of security also causes high levels of stress. Similarly, work schedules, when we do not have control over our work schedules, when we are forced perhaps to go back to work and we actually prefer to work at home, or we're working on the premises of a workplace and we're forced to now work at home. Either way, if we are uncomfortable with the schedule or the location of work, that causes stress. Just as unfair treatment, and we know that in workplaces there is a lot of unfair and unjust treatment, and certain groups of workers and other individuals are experiencing higher levels of unfair treatment than others. And finally, high job demands. And this is not a comprehensive list. These are examples, so you get the sense that these workplace psychosocial stressors contribute to our job stress, which in turn contributes to our experiences around mental health. And this is because the majority of people, as I stated earlier, spend most of their waking time at work in experiencing or doing their work. And so workplace conditions, both physical and social/psychological experiences at work, can impact mental health and well-being of workers. And those impacts are profound. And again, these are all evidence-based, okay? These outcomes, I'm not just pulling them out of my head. We know that workplace psychosocial stressors are related to a number of outcomes at home number of outcomes at work and a number of physical and psychological outcomes in individuals. So, for example, psychosocial stressors have been connected to family conflict, marital stress at home, decreased satisfaction with life, work-life conflicts, and negative crossover, which really has to do with the negative effects of work crossing over and affecting our home life. Similarly, these workplace psychosocial stressors have a negative impact on the job. We see relationships with absenteeism, turnover, we see decreased commitment and engagement, and we also see performance issues as well as increased burnout. Furthermore, what is significant is that over time, what we have seen is that these psychosocial workplace stressors are related to really important physical and psychological health outcomes, such as cardiovascular disease and diabetes, mental health disorders, psychological distress, suicidality, musculoskeletal disorders, substance abuse disorders, and also decreased safety at work. So there are lots of reasons why we want to reduce these workplace psychosocial stressors. Furthermore, there have been the data prior were based on individual studies, and then there's also these meta-analyses, which are sort of a combination and pulling together groups of studies. And these meta-analyses have shown that exposures to job stressors are associated to increased risks of suicide ideation and suicidal behaviors. They're related to things like elevated risk of burnout. Higher levels of workplace stressors are associated with elevated levels of depressive symptoms. So what I'm doing is I'm making the case that the workplace needs to be considered a significant factor when we talk about mental health, because there are modifiable aspects of the workplace that can actually help. We can reduce these risk factors. We can reduce these outcomes. Furthermore, this is a really interesting meta review. So this is a review of all of those other reviews. So, and this was published just recently in 2021, and it basically demonstrated that the relationship between these psychosocial work factors and cardiovascular disease, as well as the relationship between these psychosocial workplace stressors and mental health disorders, are both significant. And they're stronger than other outcomes that were studied, other outcomes. So that the idea is that here, workplace psychostressors are really important for cardiovascular disease and mental disorders. And that the magnitude of these associations are actually stronger for mental disorders than cardiovascular disease. That's not to say that basically we need to be paying attention to these psychosocial stressors, and especially because they are modifiable. And so there are ways that we can address these psychosocial stressors. Okay, there are ways that, again, that research has demonstrated, and theoretical theories around job stress and job strain have shown that reducing high job demands, increasing worker control over work, reducing things like incivility and bullying, and increasing social support and inclusion are related to reduced stress and, in turn, improved mental health and physical health. So here we know that these are modifiable risk factors. These are modifiable aspects of the job. And let's talk about now prevention. How do we do that? We need to target these factors, and we need to discuss how to actually reduce occupational stress. And clearly, workplaces and leadership has control over much of this. So examples of restructuring and redesigning work include things like reducing demands by reducing work hours or increasing the number of people doing the job. But unfortunately, what we see over and over again is workplaces that people are asked to do more and more with less. We saw that during COVID and with healthcare workers, especially, and that did not go over well at all. We saw significant increases in burnout, significant increases in mental health and suicidality. So reducing demands through reducing work hours or helping people by increasing the number of people doing a job is a way that workplaces can address these psychosocial stressors. You can also increase job crafting, and that's the idea that we want to give people some control over how they do their job so that it's more comfortable for them to do their job. We can also increase the safety at work. And there are ways of increasing safety at work by slowing down, reducing the demands. And we can talk about a number of real world happenings right now. We see this in the transportation industry. We see this across the board in all different kinds of industries where safety is a key concern and where there seems to be a lack of attention to safety, a poor safety culture. And so that high level of concern over safety contributes to our stress. So other examples of restructuring and redesigning work, increasing worker control over how, when, and where people do their work. Okay, we know that things like schedule flexibility, working from home, if people want to work from home, and time off policies are all ways of increasing control over work. And also, we can look at increasing social support at work, increasing the sense of belonging and connectedness. And what my line of research over the past 24 years has focused on is really increasing this support through training supervisors on supervisor supportive strategies. And that leads me to really concluding that here, I'm not concluding my talk, I'm drawing a conclusion that work can promote and protect workers' mental health if we go about this the right way. We can do things by increasing social connectedness and belongingness at work, increasing purpose and meaning, providing schedule and routine, and work can also provide financial income when it is sufficient enough. So work can be positive. It's not all bad. Work does a lot of important things for us. Work is extremely important for our well-being. And so let's really promote that and lift that up, while at the same time reducing those psychosocial risk factors that lead to high levels of stress and ultimately increased physical health problems and mental health problems. But let's talk about how work can promote health. One of the challenges here is that workplace mental health interventions are difficult to see and evaluate. And when we want to really understand and know and promote evidence-based practices, we want to see research conducted on these interventions. However, unfortunately, there's really a dearth of research on evidence-based workplace mental health interventions, and specifically that take an organizational level approach. We have seen a number of individual level interventions designed for improving mental health be evaluated, and some of the data aren't very supportive. They sometimes have no effect. And there are conclusions really drawn that we need to be taking more of this systems level, organizational level approach to workplace mental health and addressing those psychosocial risk factors, reducing those, and promoting the positive aspects of work through interventions. And we need to evaluate those interventions because a lot of what is out in workplaces is not evaluated, and we don't know if it actually works. And this is a key important point. So I'm going to now move on and spend the rest of my time talking about why I have chosen and my colleagues have chosen to really target and focus on social support. Social support and social integration are repeatedly shown to be related to better health and longevity. And we know that social connections and the importance of social connections is significantly tied to psychological health and physical health. And I want to specifically call out Dr. Holt Lundstad, who has done quite a bit of research on social connections. She's a social psychologist and has done impressive work on the importance of social connections to our mortality, and that social connections are more important to our physical health outcomes than even a number of individual level health factors, such as smoking cigarettes. Her data has shown that over chronic loneliness and low levels of social connection are very, very much tied to our physical and psychological health. And like I said, over some other risk factors that we typically look at. And this is something that we can actually modify in the workplace. So increasing relationships, connectedness, and support at work is a way of promoting and really taking a preventative approach to mental health. And where I further have focused in is on the role of the supervisors. And I talk about the role of the supervisors as being the missing link, a missing link, when we address mental health challenges. 80% of supervisors and managers believe it's part of their job to support worker mental health. And 65% believe that they could actually be more effective at their job if they had training related to supporting worker mental health. However, only 30% of managers have indicated that they've been trained to support worker mental health, and only 30% of employees have actually said that their company leadership speaks about mental health and openly about mental health and psychological well-being. And some of that now has been really increased by by COVID and the experiences that workplaces had with COVID, when there was the great resignation and many people decided I can't stay in this job, I have to find another job, or I have to exit the workplace if they had the privilege to do so. But what workplaces experienced was a kind of face-on realization that workers are experiencing mental health challenges, and that workplaces are a venue, a context, a kind of system that needs to be addressed for improving mental health. And as I said, my own research over the past 20 years has been focused on training supervisors how to increase those social connections and that supportiveness. And I've done this through really 6 different randomized controlled trials. And the first of which was a large study that was funded by the NIH and the CDC called it was the Work, Family, and Health Network that evaluated the effects of implementing a workplace intervention on workers' health and well-being, as well as on their family members' health and well-being. It was an extensive study and had many different teams involved. And it was really the most extensive work family intervention research study that I'm aware of. So that was the family supportive supervisor behavior training was developed as part of that project that actually lasted from 2025 to 2014. And I worked very closely with my colleague, Dr. Alan Kosick, on developing this specific family supportive supervisor behaviors. That then led to a number of other studies that I have conducted, and I'll just briefly hit on, that have modified this training to provide, for example, supervisors training on how to better support sleep health in their employees, or supervisors training on how to better support veteran reintegration into the workplace. These different modified versions of this training have every single time shown significant improvements in employee health and well-being outcomes. So in other words, when we train supervisors using a computer-based training, a 1-hour computer-based training on concepts of social support, we are seeing that then spills over. It's a multi-level effect. So it spills over to the employees, and we see positive effects on employees 6, 12, and 18 months down the road. And so my passion is to get this out, because it's working. And the reason it's working is because I think they're easy, simple to understand. So this is just some examples of papers that have been published from using this integration actually of family supportive supervisor behavior training with a kind of adaptive model of increasing control over work. And that was part of the Work, Family, and Health Network. But you can see that this intervention that was implemented in grocery and retail, healthcare, and information technology shows things such as the intervention, and these are all in randomized controlled trials. So you have a control group and an intervention group, but we see things like increased job satisfaction, lower intentions to turn over. So this is reports of employees. Higher reports of physical health of employees, improved sleep for employees. That's when you train the supervisors. We're seeing this in the employees. I don't have time to run through these, but I'm going to just let you know, and I am happy to share slides in the end. Another example is the safety supportive supervisor training. And again, this training of supervisors led to improvements in the employee outcomes. And this is actually done with city municipal workers, and they were sort of similar to construction workers. Similarly, the military employees sleep and health study showed that sleep supportive training, and combined actually with actigraphic sleep tracking, led to a number of important psychological health and well-being outcomes. And finally, the psychological readiness supportive supervisor training, which is the mental health training it was originally called. It was developed in a study that was funded by the DoD. I worked closely with Dr. Jennifer Dimmoff, and I'm going to now elaborate on that specific training that focused on 6 actual key concepts. So Dr. Dimmoff and I talk about proactive and responsive mental health support strategies, and it's the idea that we need to facilitate how supervisors support mental health through emotional support, instrumental support, role modeling, and reducing stigma, which I'm going to now move into. And also then responsive strategies by recognizing warning signs and being able to respond. Key here, supervisors are not supposed to be therapists. So this is just the idea that we need to be paying attention to employees. We need to be paying attention to those people who are in our lives. And when we see a change in behavior, we need to be able to recognize that and then respond. That training has been shown in both military and non-military samples to improve the leader, the trainees, basically reaction to the training. So the trainees themselves report positive outcomes. And this is from one pilot study. This is just an example from one pilot study. But it shows positive reports, reactions to the training. So for example, a supervisor stated, excellent training, and I learned so much. I would love for this to have many modules that can be taken over time. The supervisors, trainees report high levels of satisfaction if you look at the manager reaction to the training. And they learned over and over again. These data are just from one small pilot, but this has been repeated. Furthermore, what we found with this training on these are mental health supportive strategies, supervisor supportive behavior strategies, that when we train the leaders, and this is a combination of, these data are actually a combination, they're mostly from a randomized controlled trial with military. But when we train, these were junior platoon leaders on the mental health supportive strategies, we saw that their soldiers reported that their leaders had increased role model. They exhibited increased role modeling support behaviors, and they were more supportive around stigma reduction. So they were helping to reduce the stigma around mental health. We also found that the soldiers and employees in some pre-test, post-test studies reported lower levels of perceived stress following the training, lower levels of psychological distress, reductions in anger, and reductions in loneliness. And anger and loneliness are two very important risk factors for poor mental health. So the overview of these mental health supportive dimensions, and I just published a paper in Occupational Health Sciences. It's not out yet, but it's in press, on this framework. And sometimes I should say that we categorize stigma reduction as part of the reactive or responsive strategies. But regardless, these are the 6 strategies or support dimensions that we have focused on and trained supervisors on and shown improvements. So what are these? I have about 5 minutes, and I'm going to just go through these. So the first one is emotional support. So what does that really look like? What do you do to help your workers feel heard? And again, I want to emphasize this can be trained in a 1-hour computer-based training. It can also be trained in a face-to-face training. These strategies are not, it's not rocket science. But what it does is it reminds supervisors and managers on how they're supposed to relate to people. So examples of increasing emotional support, increasing face-to-face contact with employees, knowing more about them, asking how they're doing, expressing appreciation for what they're doing, for their contributions to the team, asking open-ended questions about how people are feeling, their general well-being. Okay, know your team members, basically. Second strategy is instrumental support, making practical arrangements so that workers can meet both ongoing demands and also unexpected personal demands. And some examples of those include providing clear guidance on available resources. Okay, many organizations have employee assistance programs. That's a behavioral health resource. It may also have financial health, financial resources. There are other aspects of EAPs, employee assistance programs, but we know that many people don't know that they exist. So having supervisors and managers know about the available resources to support employee mental health is key. Having supervisors and managers facilitate an employee who needs to seek behavioral health care if they ask. Identifying where people maybe need some education on the importance of healthy behaviors. Okay, these are all just examples of instrumental support or practical support. Role modeling, and this is the idea that supervisors and managers have to demonstrate by example. You've got to walk the walk. got to take care of yourself and show that you're taking care of your own well-being as a supervisor or manager. And so this really has to do with showing that you take time off to take care of your own behavioral health and psychological health, sharing your own mental health success stories, walking the talk, demonstrating that you're taking care of your own mental health. Furthermore, and I actually want to say that these can generalize. I talk about these as supervisor supportive strategies, but we're also now starting to talk about them as coworker supportive strategies. We haven't evaluated those and tested those yet, but we believe that these can be generalized to coworker support. Reducing stigma. And this is a biggie because a lot of stigma exists around mental health treatment seeking and just experiencing mental health challenges. And remember the numbers? Either if we are not experiencing a mental health challenge, our employee is, our supervisor is, our family member is, everybody is at some point, many people at some point are experiencing a mental health challenge. And we in our lives are going to be engaging with people with mental health challenges, because remember the numbers, it's maybe 20% or 25% of the population are experiencing a mental health challenge at any point in time. So reducing stigma is important. Doing things like seeking help yourself as a supervisor or manager, knowing about mental health resources. This is all healthy leadership practices, okay? And then also being responsive and aware of mental health challenges and being aware of when somebody has a change in behavior, perhaps on your team. Okay, looking out for warning signs that a leader might notice, noticing distress, noticing perhaps social withdrawal, noticing attendance problems that are all of a sudden different, that increase. So leaders need to know sort of what baseline behaviors are for employees, and then when people start varying from those. And those are called warning signs. And so recognizing those warning signs, and when we see changes from an individual's normal behavior. Social withdrawal for one person may look different than social withdrawal for another person. And finally, really understanding what actions are needed, and being aware and improving one's knowledge and literacy around mental health. So warning signs, responses, okay, attending to, communicating, and touching base. If you recognize somebody as having a challenge, check in with them, provide them with some resources, and then touch back. I'm going to close out by, first of all, making sure that everybody at this point is aware of the mental health crisis line. The mental health crisis line came into effect in July of 2022, and is now available across the country. And this should be in everybody's back pocket, and it's available in different languages, and in Spanish right now. I would like to acknowledge some of my key collaborators and coworkers and team members. Not everybody, but they're. We say it takes a village. This work doesn't happen with one or two people. It happens with major teams, and it also happens with a lot of funding. And so I want to recognize again my funders of the Department of Defense, the National Institutes for Health, and also the National Institute for Occupational Safety and Health. And again, I am with the Oregon Institute of Occupational Health Sciences. And if you grab that QR code, I'm told it's going to take you to our website. And we have a really cool new, just went live like 2 weeks ago website. So if you haven't checked it out recently, take a look. We have all kinds of exciting trainings, tools, and information and education available. Okay. Hey, I think
Thank you.
did.
Yeah, you did. Thank you so much, Leslie. And because the talk is so interesting, we had a lot of questions and a lot of chat. And we'll try to get through as many of the questions as possible. And so let me start off with a few questions that we're really focusing on. How can unions help, or have unions help to try to implement the kinds of changes that will help to prevent mental illness or reduce job strain or stress? And if it's not unions, who is it that's pushing in this direction?
Right, absolutely. I think unions are absolutely critical to pushing for these changes and pushing for them at the really the larger organizational level, because sometimes it's not going to happen unless unions and the strength of unions and the power of unions is behind it. And so part of what we've been, I mean, this work has been going on for decades, trying to inform workplaces. So what unions can do is help in sharing the information, sharing the data that we have, sharing. I mean, I'm happy to make this slide set available in a PDF form. It is copyrighted, but you can absolutely share it with management in moving forward some of these practices around job redesign and some of this data that we know that the incredible impact of the workplace and how it affects our psychological and our physical health. This is documented. And so I think sometimes it's just organizations, I mean, either they don't want to move or they don't understand, and they have to be hammered with this information. So I think unions are in the best place to do this. You know, as researchers trying to get the word out, we share as much as possible. But I think unions are instrumental in sharing and getting the word out.
Great. And the points that you're making about social support and how critical that is, social connections as a key factor in kind of making people more resilient to job stress and elevating their mental health has been really important. So there's a question about peer-to-peer support, which gets back at your coworker support training that you're currently looking at. Is there any evidence around peer-to-peer? Because not a lot of people have sympathetic supervisors.
Right. You know, there is some work on coworker support, but not nearly what we need to see. And I actually have one of my students who is just about to graduate, so soon to be Dr. Shailene Allen, has a particular interest in coworker support and really continuing this work and continuing this intervention research in studying coworker support. And actually her dissertation was actually on the impact of at the supervisor level, because we're talking about mid-level, even frontline supervisors, and frontline supervisors need support too. And so her dissertation actually focused on the support, the coworker support among frontline supervisors, and how that actually trickles down to their employees and has an impact on their employees, and mostly in terms of both personal, but also in terms of workplace outcomes. But we need more on this and on coworker support. And there's a lot of work in the military on peer support and the power of buddies and peers. So yes, we need to go forward with this, and I think absolutely expand these concepts to coworkers, and also studying to provide the evidence so that there is evidence that can push for these types of interventions to be implemented in workplaces above and over interventions that don't have any evidence.
So it always kind of boils down to this essential question, which is what's going to convince leadership and management to invest time and different practices in the workplace that may at some point allow people to spend more time away from work. So the question is, has the financial impact of mental health programming, like your supervisor support training, has the financial impact been calculated, and where can people find that so that they can start talking dollars and cents to management and to
So here's a slide that I have on the financial costs of job stress, and pulling on some of these data, and Jeff Pfeiffer and others have actually been incredibly instrumental in pulling out these data. We have, it's so hard to calculate the return on investment and the financial impact. So referring to some of these kind of larger assessments is what we do. So you can see here that the World Health Organization really states that that depression is the leading cause of disability worldwide. And then reviews by Greenberg et al., as well as Juliet Hassard has done a wonderful review in, I think it was the Journal of Occupational Health Psychology, on estimating the cost of job stress. And that was back in 2017. So I'm sure it's increased. But in terms of my own data, I don't have those specific numbers. But unfortunately, this is, I think, what we need to convince. I like to convince people that it's important to do because it improves mental health, and dollars talk.
Yeah. So we know the cost side. We don't know what the benefit side is, and that's always the challenge, because it's hard to calculate. And even when you calculate it, it's a big number. They don't believe it. So there you go. There's a set of other questions that have to do with, what if you're not a regular employee? What if you are a contract employee, or a person who has a gig job, or some kind of alternative work arrangement? Have your researchers addressed that when there isn't a organization you can appeal to?
There typically is a supervisor, and even if you're a contract worker, and it's sort of that point of contact is going to be is the critical. So it could be the frontline supervisor point of contact. We also know, I mean, I also get lots of questions about, well, what about virtual working from home? Yes, we can establish relationships. We can establish relationships virtually. We can make sure that we're checking in. So in these other types of non-traditional either schedules or jobs, there are ways. We have to be more creative, but there are ways of establishing that support and providing that support.
Basically you have to be a member of a group that provides that.
Right.
And that's really good. And what we're always up against is a lack of empathy by the people who run organizations. And I've even heard people make snide remarks about empathy being like me-pathy. It's all about me, and they reject it out of hand. What do you think is going to get us over this threshold? You talked about the stigma and how to get over the stigma. So I don't think it ever really goes away. But and this is the final question, unfortunately, with all the other questions being left unanswered. What's going to get us over the threshold of people recognizing that mental illness is a right? I mean, mental health is a right, and mental illness needs to be addressed.
In terms of workplaces, I think that we have seen progress in Europe. We also see progress in Canada. They have a standard for mental health in the workplace, and I think we are going to have national policy around mental health at work. And I think I think we're slowly inching there. I mean, I honestly, after decades and decades of research on, and seeing my own and many others' research on the impact of the workplace on psychological health and well-being, to see such a shift with the onset of COVID, I started getting hopeful. So I'm more hopeful now than I was 5 years ago, and we just have to keep pushing.
Yeah. Well, it's been a wonderful talk. thank you so much for making time to share your research and this information with us. I hope everybody goes home with several ideas about how to improve their own mental health and also to convince some supervisors to model it. So thank you so much, Leslie, and thank you everyone who's participated. And I'll leave it to Michelle to close it out.
Thank you all so much for being here, and I hope you have a great rest of your day.
Thank you.